And a good Saturday morning, too. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic at 4855 East State Street in Rockford. And with us today again on the program is Dr. Kim Osborne, who is an assistant there at Warner Chiropractic. And it's not Sesame Street, but we have another letter for you today. The letter is E.
Vitamin E, and Fred, you might be surprised to know that vitamin E comes from sesame seeds.
Are you kidding me?
So, see, the prophet in you is coming out again, Fred.
I guess, or the non-profit. I'm not sure.
Or the nut.
Well, the nut part, yes.
From the sesame there.
That's for sure.
Okay, but today we're going to talk about vitamin E, or what we could call alpha-tocopherol. It's a vitamin, Fred, that as we talked about vitamin C last week, vitamin E will help you live longer, help you live better. It's excellent for your heart, for your circulation, problems with hormonal difficulties in women. There's a number of different things that vitamin C is wonderful for, and we want to make sure that the listeners are getting enough vitamin E.
You know, that's another vitamin. We talked about C last week, and I take it every day. I also take vitamin E every day and have for many years, and take the D-alpha rather than the DL-alpha.
Absolutely.
When you're looking on the label, if you see DL, then you know it's synthetically produced.
Yes. The one is synthetically produced out of coal tar. So if you like vitamin E in its artificial state, maybe just chew on some coal and see if that helps. But there are better sources of that than taking it out of coal, and that's when it comes out of vegetable sources, natural vegetable sources, and that's the D-alpha. The only difference chemically when you look at that is when they shine a light through the vitamin E, it'll rotate it in to the right if it's the D form, and if it's the DL form, the light rotates to the left as it goes through there, and your body knows the difference. And so a lot of times when people say, well, we tried vitamin E, or they did a study and they found vitamin E didn't help anything, they did the study with the artificial form. And there's been noted studies, and I've talked to professors that even did these studies, and they said, well, we're going to see if it prevents cancer, if it prevents prostate cancer in men. And I said, well, what form of vitamin E are you taking? Well, we use a DL form. Well, that's the form that doesn't work. So why would you start using an artificial vitamin that doesn't work and then try to find out if it's going to help the patient?
Now, of course, the natural form is just a little more expensive, but well worth it, isn't it?
Absolutely. It's a little more expensive, but it will do the job. And this was proven back in the 50s, Fred, where some doctors by the name of the Shute brothers.
From Canada,
a couple medical doctors that did the initial findings on vitamin E that proved that not only did it help heart disease, and people that had heart attacks no longer got the heart attacks, problems with circulation, diabetics, that they found that they were going to have their legs amputated. The Shute brothers started giving them large doses of D-alpha tocopherol, and they found that in many instances, not 100%, but in many instances, circulation improved and the people were able to keep their legs, which would be a nice thing to do.
Also for burn victims, I know that they used it topically.
Yes, they did.
And it actually made the scarring less.
They took it orally and topically. They did it both ways, and yes, there was less scarring and quicker healing.
And it's also known as an antioxidant like vitamin C, isn't it?
Yes.
Yes, it is. And again, like I was saying with the vitamin C, what it does is it goes in, and this time it will work in more of the fat-soluble cells, but it does the same function like a Pac-Man, eating up those free radicals that damage tissue.
How good it is to take both vitamin C and vitamin E. And then you'd have the double benefits of it going over the whole body and helping you to stay away from cancer and heart disease, the two biggest killers in America.
Well, you mentioned sesame seeds contain vitamin E. What other foods contain it in its natural state?
Well, all raw seeds and nuts would have vitamin E in it. Vegetable oils, corn oil, wheat germ oil especially is very high in vitamin E. Soybeans are high in vitamin E. However, through the milling process, when they make these oils and such for cooking oils, you lose a lot of the vitamin E. Sometimes they'll put a little artificial vitamin E in there to keep the oil from turning rancid. And they'll say, well, we've got natural antioxidants to keep the oil. Well, they're putting the DL form just to try to keep it from spoiling, which, it's good that it's not spoiled, but for human use, you'd want to have the natural form.
When I was a little boy growing up, my mom read Adele Davis's books, and she was big on nutrition and wheat germ, and so my mom cooked everything with wheat germ, which, of course, as you mentioned, contains vitamin E.
Yes, well, the RDA value, or what the government recommends for males and females, adults, are 15 milligrams of vitamin E.
That sounds low.
15. Adele Davis, who you just mentioned, said adults should have 100. And, of course, she would be more into trying to get 100 out of natural foods. She was more into the natural foods than supplements, but it is almost impossible. You'd have to eat a lot of sesame seeds to get your 100 milligrams.
Right.
So it's very important to supplement, because in this day and age, Fred, most of the foods that we buy don't have enough vitamins in there.
What about the form in which you take it, the type of supplements? Because, once again, you are very concerned about the pill not passing through your system. You want to be able to absorb it.
It's usually in a gelatin capsule, so it absorbs very easily. It breaks down very easily. You can also get it in a tablet form, a succinate form, which also works, but usually it's found in a gel capsule that has some oil in with it with the vitamin E.
So it is easily absorbable by your system?
Yes, but don't let the label that says natural vitamin E fool you, because you can have a gel capsule that looks natural. It has natural vegetable oil in the capsule.
And it says natural.
It says natural because there's natural oil there, but it's not a natural vitamin. And it's a little trickery that they can play on their labeling.
So what you want to look for is the D-alpha.
It says the letter D-alpha.
Not DL-alpha.
Absolutely.
D-alpha. Vitamin E.
Now, vitamin E helps prevent cancer, like we said, prevents blood clots, prevents aging. It's oxygen sparing. Your red blood cells actually hold more oxygen than normal if you're taking vitamin E. It increases the size of your blood vessels, or dilates your blood vessels so that more blood comes to the area. That lowers your blood pressure, and it increases the strength of your contraction of your heart. So your heart actually beats stronger when you're taking vitamin E, and that's why it's so beneficial for heart disease or preventing heart problems, stroke victims, circulation problems, cold hands, feet. These sort of things respond well to vitamin E therapy.
Now, we'd mentioned last week that vitamin C, it's hard to take too much because it's water soluble. What about vitamin E?
Well, vitamin E is excreted through the urine also. So if you were to take that, your body will hold that in your body longer. It can hold vitamin E up to 3 days in your body, but not for a long term. So vitamin E is not like vitamin C, which your body needs constantly every single day. Vitamin E, you could miss a day and it wouldn't hurt anything, but it's good just to keep a regular amount.
Now, as far as the amount a person takes, you mentioned the government said 15 milligrams a day. Do you have any recommendation for how much vitamin E we should be taking?
Just as a standard dose for the average adult male or female, you'd want to take between 200 and 400 international units. If you're dealing with a patient that has circulation problems, then you're going to want to go as high as 1,000 international units a day.
And I'm on a regimen, daily regimen of about 800 units a day, and have been for many years.
Well, you'll still be here 100 years from now doing this, right?
Well, yes. Now, I really believe in it, Dr. Jim, and, a person needs to be convinced about these things, because we see so many things, for instance, on television, whether it's drug commercials or even, nutritional things. There are a lot of things going, as you look at these infomercials, and so I know some people must be saying, well, how do you know who to believe?
Well, that's a good question. Usually when you're seeing something on these infomercials on TV, Most of that's pretty good, Fred. I mean, there's a lot of people that are promoting their own product, and that's what they want to do. They want to sell their product. Most of those are pretty good. When you see it on TV, from what I've noticed, they're not pushing the artificial as much. You'll find that in your stores. But usually when they're saying they've done so many studies and this has helped, that they might not tell you it's the vitamin E that's in there that helps the heart. They might say, take Super X, and that's going to help your heart. And what's helping you is probably the vitamin E that's in the Super X.
I suppose a person could do a little reading, too, and, bone up on vitamins and what effect they have on the system and whether they should be taking them or not.
Oh, there's a lot of good books out on that. On the web, you can get information. Everything that we're telling you is something that's readily available to the public. Just look it up. Look it up in a book on nutrition, and they'll tell you that.
So vitamin E is important along with vitamin C. They're both antioxidants. Vitamin E has different properties, and so you shouldn't take one to the exclusion of the other.
No, you should take both of them. Vitamin E is going to help more with, it's actually been proven to work better than taking an aspirin for blood clotting to reduce that. You're going to have problems with when you're walking and that's going to help your circulation with those things too. Anyone that's having an abnormal menstrual cycle, they'll find that vitamin E will help them also. Hot flashes, fibrocystic breast disease. So a lot of female issues can be alleviated with vitamin E as well. So
also helps, they found, with racehorses. They give racehorses vitamin E, and it doubles their chance of winning. So, it's good for athletics. And I know when I was in high school in athletics, I was just learning about vitamin E back then, and I found that if I took vitamin E, it increased my endurance substantially.
Well, that's the
oxygenation.
Yes,
yeah. More oxygen coming to the body. Like I said, it has an oxygen-sparing effect, increases the size of your blood vessels, increases your heart contractions, and increases circulation.
Well, these little antioxidant vitamins, C and E, pack a big wallop, and they're not that expensive, and it's really something to look into if you're not taking vitamins.
It's one of the best things that you could do, the cheapest thing you can do to live a long and healthy life. And so we encourage people to take 500 milligrams of vitamin C per day and 200 to 400 milligrams of vitamin E, the natural form.
All right. Very interesting stuff. I know you have a website.
www.warnerchiro.com.
And if people want to call you,
815-398-8111.
All right, we call him Dr. Jim, Dr. Jim Warner of Warner Chiropractic, and also Kim Osborne on the program today. Thanks so much for being with us.
Thank you. Have a great day.
Thank you.
And that'll do it for Health Matters Today.